Good evening, and thank you for joining us on this Christmas Day. There are now 2 COVID-19 vaccines that have been approved by Health Canada, but tonight there are questions about whether women who are pregnant or trying should get vaccinated. The national committee that is advising the government on immunization has provided some guidance on this issue. Abigail Bimman is looking into what other countries are doing.
New this week, Canada's National Advisory Committee on Immunization recommends it would be prudent to delay pregnancy by at least 28 days after the completion of a 2-dose series of vaccines.
Based on really expert opinion and trying to be as safe as possible, but really is not based on any data.
Earlier this month, NACI released other recommendations. In general, pregnant women shouldn't get the vaccine due to a lack of clinical evidence. But for those at a higher risk, NACI says the vaccine may be offered.
I think it's always going to be an individual decision.
Dr. Deborah Money is one of the authors of a statement from the Society of Obstetricians and Gynecologists of Canada taking a similar view. For those at high risk of infection and/or morbidity, the documented risk of not getting the vaccine outweighs the theorized and undescribed risk of being vaccinated during pregnancy. There is evidence pregnant women can get more seriously sick with COVID-19, but as for those with a low risk, the SOGC doesn't offer a hard no, unlike NACI.
We would obviously much prefer that there was actually evidence of safety and efficacy in pregnancy, but we're not likely to get that information for a very long time. And in the meantime, to completely exclude pregnant women from being able to access the vaccine felt unhelpful.
The SOGC advice is in line with the United States, while the United Kingdom takes a harder no stance in general.
We have no evidence of harm, I think they're just trying to be extra careful because pregnant women have been excluded from trials that have been done to date, and that's a bit of a touchy issue.
Dr. Eliana Castillo believes pregnant women should be part of vaccine trials. She says the lack of data contributes to fear.
A fear that the public takes on. And then we wonder why patients are hesitant sometimes.
Dr. Castillo sees many patients worried about whether to get vaccinated and points out so many vulnerable healthcare workers in Canada are of childbearing age. With conflicting information out there, all experts stress talking to your own healthcare provider to help make the right choice. Abigail Bimman, Global News, Ottawa.